Phatak Materia Medica, that is ACTAEA spicata. So it is a small remedy, mainly affection with joints. So according to Phatak Materia Medica, it is a joint centric remedy. Main is action on the joint, small joint, especially wrist and ankle joint. Mainly wrist affection is more. Whenever there is a wrist complaint, first remedy we can think is ACTAEA spicata for acute complaints. Then ankle and finger. This is more a rheumatic remedy, generalized rheumatism, but localized pathology and hypertensive sensitivity. Means patient is rheumatic diastasis or rheumatic complaints he has, but mainly pathology is localized to the wrist or small joint and with hypersensitivity. Phatak clearly emphasize on the swelling of the joint, pain aggravated by touch and motion, and paralytic weakness of affected part. Then main core of the remedy is small effort, big joint reactions. Slightest fatigue leads to swelling, slightest exertion leads to pain, slightest touch leads to aggravation. The joint behaves as if it has lost the tolerance. So ACTAEA spicata joints protest early and react intensively. Mental picture is not so much important, but some symptoms that Phatak has mentioned lead to differentiate the remedy from the another remedies. Symptoms of the rheumatism or wrist joint pain appears after fright, or symptoms may follow the fatigue. Mentally patient is quiet, not dramatic, more focused on physical limitation. In OPD, patient may say that, or patient's version is that, doctor, I don't know why it swells so fast. I hardly to do anything. The mind is calm, but body is overreacted. Physical generals are most important. Hypersensitive to cold. Cold exposure worsens the joint complaints. Shortness of the breath after cold exposure. The patient avoids the cold environment. So thermally patient is chilly. Energy and weakness, general weakness is there. Paralytic weakness of the affected joint, not total. Feels old as if age is less. Phatak mentions this is an old age remedy, but clinically this remedy can appear in early stages. Modalities are very important for the ACTAEA spicata. The aggravations, change of the weather, slightest exertion, cold, night, and touch. These are the five aggravating characteristic aggravation of the ACTAEA spicata. Touch and cold aggravation is very marked. Peculiar symptoms related to the joint. Wrist joint is mostly affected. Ankle and finger joints also involved. Swelling after slightest use. Tearing, tingling pains. Pains aggravated by motion and touch. Joints feel as if weak, unreliable, almost paralyzed. Eye symptoms, object look blue, then ears, twitching pain on sneezing, pain on blowing the nose. These eyes and ear symptom uh, may help to the selection of the remedy. In which clinical condition we can use ACTAEA spicata? Mainly early inflammatory joint arthritis of the small joint, wrist dominant arthritis, overuse syndromes with inflammatory reaction, degenerative joint diseases with hypersensitivity. Mainly in rheumatism or rheumatoid arthritis or SLE, where there is peculiar joint in small joint involvement, you may think of ACTAEA spicata as a acute remedy. This remedy has a functional inflammation before the destruction has start. So we have to differentiate many more rheumatic remedies that that remedies has closely related to the ACTAEA spicata. First remedy, of course, rheumatic remedy king is the Rustox. Both remedy have joint pain worse from movement, but Rustox better by continued motion. ACTAEA SPICATA worse by movement and touch. Movement relieves Rustox. Movement aggravates ACTAEA SPICATA. Another remedy that is we must have to the differentiate is the Bryonia. Both have aggravation, both have joint aggravation by motion, both have joint pain. Bryonia wants absolute rest, stitching pains, while ACTAEA SPICATA is swelling with weakness and tingling numbness. Another remedy we must differentiate is the causticum. So, common is weakness, causticum is neurological and contractures. Main causticum is neurological remedy, while contractures are the key features of causticum. While ACTAEA SPICATA is local joint weakness and swelling. So, next part that in lastly, Phatak describe his clinical relationship. So, he described I think 5 remedies in the clinical relationship, so that we can in acute rheumatism we can use ACTAEA SPICATA, and in that remedy is the sequelae remedy of the ACTAEA SPICATA. So, as I studied, the ACTAEA SPICATA is acute of all these remedies or related remedies, or this remedies follows well or complementary remedies to the ACTAEA SPICATA. Complementary remedy is in a simple language that the stage of ACTAEA SPICATA is the remedies. First remedy have their own symptoms, and that remedies symptomatology is covered by another remedy, and that completes the cure of the first remedy. So, that in first remedy that Phatak described is colophylum. So, colophylum is the deep acting remedy. When wrist joint pain, inflammation, swelling, in acute stage we can give ACTAEA SPICATA repeatedly, and then follows by colophylum, which has more action on ligament and joints of the small joint, and it is complementary to the ACTAEA SPICATA. So, like that, colocynth with neurological pain, sabina with joint pain and uterine issues associated, sticta with rheumatic pains and respiratory complaints, stiffness of the joint, crackling of the joint, vola odorata with rheumatic tendency. So, in such a way that the complementary remedies are very useful in day-to-day practice when acute stage is covering, and we have to complete the cure, or we have to eradicate the tendency. We need to the complementary big remedy for such type of acute remedies, and after that we need antimiasmatic deep acting nosode, which that nosode shouldn't have about the tendency of the recurrence of the disease. So, ACTAEA SPICATA may open the case of these and above remedies, that colophylum, colocynth, sabina, sticta, vola odorata, complementary to the completes its action. So, main core or prescribing totality of the ACTAEA SPICATA, that the 5 to 6 patient 5 to 6 symptoms that are very useful uh, useful in prescribing the ACTAEA SPICATA. So, first, small joint involvement. First, small joint involvement, especially wrist swelling prominent. Wrist swelling aggravated by touch and motion. Slightest exertion causes the swelling, tingling and tearing pain, and hypersensitivity to the cold. So, when joint reacts more than they should, ACTAEA SPICATA is the remedy. Common mistakes while using the ACTAEA SPICATA is that using any case of arthritis. In case of large joint arthritis, pain improves by motion and no touch sensitivity. This remedy shines in early localized hypersensitive joint pathology. It is not useful in destructive joint pathology. In early joint pathology, most commonly potencies that I use for ACTAEA spicata is the 6 and 30 potency. With frequent repetition, as soon as the patient feels better, the repetition is reduced. Means the patient have severe pain, ACTAEA spicata 6 3 times or 4 times a day. If pains come, it comes 2 times, 1 time, and then stop. So, in 3 words, ACTAEA spicata I can describe is small joint, especially wrist, with swelling, with sensitivity to cold, motion and touch. This is the ACTAEA spicata. Thanks for patience listening. Thank you very much. We can see tomorrow another remedy from Phatak Medica. Thank you very much. Bye bye.